Welcome to Kaleida Health Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Kaleida Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Tim, thanks for joining us today on Medically Speaking. If you can, tell us a little bit about what your role is as the Director of Corporate Emergency Management.
Absolutely, Mike. I am the Director of Corporate Emergency Management for Kaleida Health. Been with the organization now for about 15 years. And this job encompasses a whole lot of planning, mitigation strategies, interacting with all facets of Kaleida Health as it relates to everything from an active shooter scenario to a utility outage. It could be a severe weather scenario, and in this case, our pandemic situation that we're in now.
About the command center. I can see the command center in the background, so we appreciate you taking a couple minutes out of your time away from your duties there. But tell me what the command center's function is in a pandemic or an emergency like this.
Sure. So we follow, Kaleida Health and most healthcare organizations follow the HIC structure, which is the Hospital Incident Command Structure. In that structure, we have a very streamlined, defined process for delineating duties within the command center. We have an incident commander, we have a planning section chief, and all the other roles that are filled. Our primary duty is to filter all requests throughout our system through one stopgap area that we can serve resource needs, material requests, and make sure that they're delivered in a timely manner, that we can address needs and reduce redundancy throughout the system. So we're the clearinghouse for all needs as it relates to this pandemic effort.
And then inside the command center there, you have various leads from across the organization that you help coordinate their activities and the communication. So tell us what type of persons are in there, what are some of the things that they're doing?
Absolutely. So we have a mix of folks from our quality department. We have some folks from nursing in here. We have a diverse group with a diverse background. We have people answering calls as it relates to testing questions, symptomology, helping them get sampling in our drive-through stations. We do a lot with New York State, Erie County, and respond to their needs and reach out to them to fulfill our needs. And everything within our system, we've had requests come into the command center for donations, and we're glad to tell the fine folks in our community where to go to drop off those donations. Sometimes it's a material request for assets. Some of our checkpoints have called and requested additional thermometers. Sometimes it's a personal protective equipment need, then we need to deploy those assets quickly to part of our campus. So there's a whole lot that comes in here, and the folks that work in here are great. They have a diverse background, and if they're new to the command center, I try to quickly give them a crash course in incident command and get them up to speed as quickly as possible.
Sure. You mentioned before snowstorms, power outages, different planning drills that we've had. We work together on the move of Children's Hospital. So the command center structure has been a significant resource for us over the past couple of years, especially. But tell us why this is different in a sense of the length of this exercise and how long this is going to go on for the organization.
So this is a challenge, and it's certainly a challenge we're up for. This, for me, and I think that much of my colleagues in emergency management across the state and country, this is unprecedented. An event of this magnitude, when you look at the impact of the economy, businesses shutting, schools shutting, we've dealt with those sorts of things, as you said, Mike, on a short-term basis from a severe weather perspective, but it's been weeks now that we've had businesses shut, schools closed. So it takes quite a bit of planning. I think my main goal for the command center here is to keep ourselves safe, make sure that the staff in here are practicing social distancing. We're trying to take care of ourselves. We rotate so folks don't get burnt out. And we have our eyes set on the long-term goal to be able to serve Kaleida Health in the community for as long as it takes. And again, that you look at the perspective with scheduling of the staff and moving the people around and ensuring that all the needs are met, it takes quite a bit of planning.
So as we wrap up here, if you can, your thoughts, or you got any message for the community, their response thus far in terms of how they've helped the hospital out, and then as well as for the staff and how the staff have responded thus far?
So I found that people have been great. Our staff has been great. The community's been great. Again, this is uncharted territory for most of us. My advice to folks would be to stay calm. Look at the science behind things, follow the guidelines as they come out from your county department of health. And, if you do have symptoms and you are sick, call your physician. We ask people not to come to the hospital immediately. The ED, we really need you to be vetted through your physician and make sure that that's the direction they're giving you, and to call us ahead of time if you're symptomatic so we can prep accordingly. But wash your hands, practice that social distancing. It's important. We can flatten that curve if we all follow the directions. And if we stay calm and work together, we're going to get through this as a community.
Great. Well, Tim, thanks for your time today. We appreciate it. Good luck with everything. Stay healthy, stay safe.
Thank you, Mike. My pleasure.